September is Prostate Cancer Awareness Month. It's a reminder for men to keep up with their annual screenings and physicals. Joining us today is Dr. Justin Drobish. He is a urologist at Corewell Health. Thank you so much for joining us.
Thank you for having me.
Yeah. What is the best way for men to kind of to prevent prostate cancer?
That's a great question. We get asked this every day. Patients are very interested in preventing prostate cancer when they can, and they're always asking kind of what supplements or medications they can take to cut down on their risk. And unfortunately, there have not been any medications or supplements or diets that have been shown to decrease that risk of prostate cancer. So there's really not a good answer I can give them to prevent it. What I will say is obesity and cigarette smoking is associated with a higher grade or more aggressive prostate cancer when it is diagnosed. So if patients are looking for interventions, I typically steer them toward avoiding obesity, living an active lifestyle, and avoiding cigarette smoking.
Yeah, and you mentioned those screenings. How often should someone be looking to get those screenings?
Technically, the screening should be determined by their risk group, but I think that becomes a little bit cumbersome. So for most patients, my patients, I recommend they get screened once a year annually, and that's with a PSA blood test with their primary care doctor. Once a year is easy to recommend for patients, it's easy to recommend for providers, and it gives us a lot of good data.
Yeah, are there any signs or symptoms people should be looking out for?
Typically not. Prostate cancer commonly is asymptomatic, meaning no symptoms at time of diagnosis, and so screening really does become very important.
Yeah, and when should you talk to your doctors about concerns related to your prostate? What age does that happen?
Certainly. Patients who are at higher risk would be those who are African Americans and those who have had a family history of prostate cancer. And when we look at family history, we're looking at fathers, uncles, brothers, and those patients can start screening as early as 40 to 45 years old. Yeah. Everybody else somewhere between the neighborhood of 45 and 50, but by 50, people really should be getting screened with their doctor.
Yeah, and any new research or any developments in the prostate cancer treatment on the horizon?
Sure. Prostate cancer treatment is evolving constantly, and I think a lot of the treatment depends on the patient's age, their goals, and their disease process. But one of the treatments that I'm very excited about, it's a relatively new treatment, is under the umbrella of what we call focal therapy for prostate cancer. So this is treating just a small area of cancer within the prostate and leaving the remainder of the gland intact, which tends to have quicker recovery and fewer side effects. So one of the therapies we hope to offer soon is called HIFU, which stands for High Intensity Focused Ultrasound Therapy. And this can destroy prostate cancer without removing the prostate itself. It's been around for a couple years and gaining popularity nationwide, and we're excited to be able to offer this here at Corewell pretty soon. Yeah,
and I know you mentioned those screenings. Is this simply more, aside from the screenings, is this more of a discussion people should just be having with their physicians? You just recommend that?
Absolutely. Yeah. Screening, some people may decide against that, and that is absolutely their choice. But I think understanding the risks and benefits of screening, certainly it can open them up to some treatments that are a little bit unpleasant sometimes. So it's always worth having a discussion, but it's very important to get that relationship with the primary care doctor.
Yeah, and you can do that with primary care as opposed to maybe like a specialist.
Absolutely. Okay. We recommend primary care doctors do most of the screening. Obviously, when there's a question, they can send them over to us, but primary care doctors are really the first line of defense when it comes to screening.
Awesome. Well, thank you so much, Dr. Drobish. I appreciate you taking the time.
Thank you for having me.
Yes, thank you.